Well, hello and welcome to another episode of Little Learners on the Go. I am so excited. I hope you all are enjoying this season. And today we're going to be talking about advocating for your child's health. And so I have my lovely guest, my wonderful educated guest, Dr. Charlotte Walker, and I'm so happy that you're able to join us today. So welcome.
Thank you for having me. I'm excited to be here.
Yeah, I wanted to have this conversation because sometimes as parents, we don't understand our rights. Even though, someone may express it to us, I wanted us to really know that we can advocate for our child's health. And I've had so many conversations with you,
Mhm.
you assisting parents with this process,
Yeah.
right? And so I just wanted us to what does that have this conversation regarding that? So what does that mean and what rights do we actually have as parents?
To advocate by definition, right, is that we are working toward or voicing our opinion or pleading for a common cause. The first step in that is ensuring that you have the right people on your team. And so I think that as parents, the way that you start with advocacy is from the very beginning when you are picking a clinician or a practice to take your child to, right? I'm a pediatric nurse practitioner by trade, right? And so my doctorate is in nursing, and I'm a pediatric nurse practitioner. I see babies literally from the time they are born all the way to age 21, we can see. So we're partnering together for the next 20 years. And so when you are working with a practice, when you're working with a clinician, the advocacy actually starts from the beginning. By the time you have the baby, you should already have your pediatrician picked. And so you need to interview providers. It may not be the one that's closest to your house, right? Like it may be that you go in, you ask questions. We used to do a um, a class at the old clinic that I worked at. We used to have a class called Beyond the Belly for babies, like for new parents to educate them. And we would do walkthroughs with parents coming to see the clinic for the first time. They have a couple months before baby's born. We talk to them, let them know what to expect. And I think that that is where advocacy actually starts. Because if you have questions, if you have beliefs, if you have a certain way that you want to raise your child and approach their health, you're building a team, right? So I'm a part of the team too. I'm also advocating for your child's health. So when we send them to specialties, or if we are dealing with the school, which is a whole nother a whole nother part of my job, right? It's my job to not be in opposition, but to be a partner, even if what you believe or what you want to do isn't always, like, if I don't understand it, or if I may have a differing opinion. The goal here ultimately that we both have is that we are working to make sure that your child is healthy, your child is loved, developing well. And so I think that advocacy actually starts from the very beginning.
I really like that, beyond the belly, and just being able to know that you have some autonomy in regards to your child's health, right? Because
Mhm.
some people, again, like you said, based off of maybe your belief, maybe you don't feel that your child may need that immunization or whatever it may be.
Yeah.
But I think it's good to know that you can advocate. I love this field of early childhood education.
Yes.
I love helping to, one, be an advocate myself,
Mhm.
and helping parents to know that they have this right.
Yep.
Even things in the school system you can't just do without the parents' permission, right?
Yes.
And I think
Yes.
parents, if we really realize just how much um, authority or autonomy in a sense,
Yes.
not really authority, but we already
No, but
know
it
that,
is, because we can't do nothing to your child without your permission. That's assault.
right?
Yeah.
Right.
Like,
But
no, that's assault. It's
the
so blatant.
rights that you have, you know, advocating for your child, maybe you don't agree with a doctor's perspective or diagnosis,
Mhm.
and maybe getting that second opinion is a
Absolutely.
good thing. And so that's why I really wanted, sometimes you feel like you don't have any options, but you really do.
Mhm.
And I know that's why I wanted to do this, because I've you know, and especially when we talk about um, families that are disenfranchised, or you know,
Yes.
don't have the same,
Yep.
feel like they
Access.
don't, there you go, the
Mhm.
access. But parents, you still have the right
Yep.
to advocate.
Yes. And you have a bill of rights. So a lot of times when you, and this is why I encourage people to read what you sign and read what we give you, right? Like, I know that sometimes it can get redundant and it's a lot of reading, but we give you, anytime you go into any healthcare office, you are given a bill of rights. And so there's some that I will give here that I have like a list of them. And what I'll do is I'll provide you the list, and we can link it so people can download and understand and know what their rights are. So you have the right to be informed. You have the right to consent or to refuse treatment. You cannot tell us that you refuse something and then we do it anyway. It is assault. It is a, like, legally, it is assault. You have the right to a second opinion. You have the right to ask questions. You have the right to access medical records. You get to choose your providers. So if you don't like the doctor that you have, go find another one. Like, you have so many rights. Privacy, you have the right to be heard. You have the right to make decisions, and to participate in the decision making. You have the right to know all of the treatment options. You have the right to appeal your decisions, to refuse to participate in research, right? Like, so you have the right to choose like child appropriate care. You have the right to advocacy support. So I know in the hospitals, particularly, there are patient advocates that work with you in advocacy efforts. And then you have the right to report your concerns. So if you feel like something is unsafe, if you feel like there's truly an issue, you have the right to report that. And so there are a lot of rights, and a lot of the information we provide. But if you don't, we have to also know, like, from a take me out of a clinician standpoint, we get a ton of papers and we don't be reading all them papers. Right. So we have to
Right.
also make sure that we are understanding what we're signing. But you should have a bill of rights that you receive when you are getting, especially when you come to a practice for the first time. But those rights do not change. And at the end of the day, and this is what I tell all of my parents, like, y'all are here 20, 30 minutes. This your baby. So you're my partner. I'm trusting you to provide me with information. So when I ask these questions, they may seem intrusive, but I'm going somewhere with this, right? And you're trusting me to provide you with things that you can do at home to help, because our goal together as a team is to make sure that your child is well cared for. So you are not only the advocate, but you're my eyes and ears, because this magical thing happens when these kids cross the threshold of my office. They look fine, right? Like, no, the parents like, no, I swear they had 104 fever. Oh, I believe you. That Motrin done kicked in. I believe you, friend. No, I believe you. That Motrin done kicked in. So tell me all of the things that you've seen. And sometimes there are things that are like incidental, that is like, I hear you. I'm not really sure what that is, but I know where to send you. Right. And so if parents are willing, it's particularly the way that I practice, like, we're working together. So if I say, hey, I hear your concern. Right now it's cold in Florida. I know it's cold where everybody is, but it's Florida cold. Okay. We're seeing 40 degrees. That's just, it's a different kind of weather than what you think of when you think of Florida. And so I'm seeing a lot of my asthmatics come in because the weather is triggering them. And so I do a lot of educating parents. Hey, it's the weather. Here are some things that you can do. Let me make sure all your inhalers are up to date. And here are some things that you can do at home. change the AC filter, make sure that they have a hypoallergenic mattress cover, wash their hands if they're playing with pets. Pets shouldn't be on the furniture. I'm not telling you what to do, but I'm telling you, hey, these are some things that we can do to work together to make sure that your kiddo is safe. But if that cough persists, I've had parents come in and like, hey, I know you say it's the asthma, but I have further concern. Great. Here's what we can do. We'll make these small tweaks, and I'm going to give you this chest x-ray order. If you feel like this has not improved, get the x-ray, come back and see me. So I want to validate your concern, but I also don't want to expose your baby to all this radiation too, right? And so it's a delicate dance of us being partners and working together, but you have the right to it's this your baby. You have all the rights. You have all of the rights.
I like what you were saying about, because sometimes, you said it may seem a bit intrusive, but you're trying to gather the information.
Mm-hmm.
And I know you're talking from the doctor perspective, and even as as an educator, or whether they're in a childcare setting, whether they're in a school setting, teachers, we should be paying. Now, we're not the nurse. We can't diagnose with anything, but we can pay attention. And this is something that I've done through the years, right? Because our policies and procedures may say, okay, they only need to be out for 24 hours if they have this fever over 100, whatever the policy is,
right,
where you work. Nevertheless, there is a level of advocacy that we can have as educators. I've done this through the years. Hey, this cough sounds a lot deeper, or that breathing is becoming more raspy, heavier, and I really think you should take them to the doctor, right? I really think you should have this checked out. Because as you were stating, Charlotte, even with the air quality asthma wherever we live, right? Because metropolitan area is the same way, right? When the temps go up and down like that, we have to pay attention. That deep cough could be turning into something else. And so even with that, when you're advocating, kind of don't let up, right? Parents, like you were saying, you're with them all the time. And if you're noticing something, take them to the doctor.
Come see me.
I think we really, and so a part of your advocacy, parents, is knowing that take them to the doctor. Take them. Don't let up if you feel that something is truly going on that really needs to be seen by a doctor. Don't just gloss it over. Don't gloss it over. Go to the doctor. Go to the doctor. Should we question doctors?
Absolutely. Absolutely. I'm a human being just like you, right? Yes. One of the biggest parts of my job is to educate you. So I tell parents all the time, it's not just my job for you to come in and for me to diagnose and to treat, but because we are partners, you are going to take this child home. And so I find that, sometimes it may be a struggle to be like, well, why do I got to take this medicine every day? Or, but I will, as I'm doing my assessment. So like allergies is a big thing down here. And you're worried about this persistent cough, and it's a post-nasal drip cough. And so we have these tissues in our nose called turbinates. I will tell parents, like, come here, let me show you what I see. Do you see how it's all swollen? You see how it's all boggy? Do you see what I see? This is why they need their allergy medication. The reason that I say give it every day is because that fluid is just sitting in their face. It's going to, the minute they go and do what kids do, because they're cute, they're cuddly, they're gross. Okay. They're gross.
Someone I know said they're petri dishes.
They are petri dishes. They are cute because we learn as humans, we learn orally, especially as we're young. So everything is going in their mouth. It's so nasty. It's so nasty. I love them. But that fluid is there. So now it's warm and it's wet and it's been introduced to whatever bacteria or virus. It'll back up into their ears. And now we have otitis. So, or an ear infection.
I was going to say, please say that for us.
I would rather you take this Zyrtec every day, and we try to decrease the likelihood of you needing antibiotics. right? But I educate parents because do you have any questions? Because I want you to understand the why and not just what I'm doing. And I will say that I'm not sure that every provider practices like that, but that's why you got to find the right team. Right? The advocacy starts before we're even born. You have to find the right team. How do you feel about me asking questions? Can I come back if I have questions? Can I ask you questions? These are like some interview things that when you are picking a medical provider that you want to ask. You want to ask like, "Hey, look, advocacy is a really big thing. Asking questions, being transparent is a really big thing. I want to be able to have open communication with you." And especially pediatrics, like 90% of us, because I don't know everybody, but 90% of people who get into working with kids, we love kids and we love their family. We love these kids. And so we want to partner with you. We understand that you love your child. We understand that people's lives, their backgrounds, their education, all of it is different. And most times, the questions that we ask, I think sometimes people assume that we're judging, but most of us, there's nothing we haven't seen. Like, there's nothing we haven't seen. So, so we're not judging. Like, okay, if I ask you, hey, is anybody smoking in the house? Don't fib to me. One, my asthma's cutting up in this room. Two, we're not
Listen,
asking to judge, but like that's where the cough is coming from. And you may not correlate, like, hey, look, secondhand smoke can cause their asthma to act up. So I would recommend them not be around it. But if someone is going to be smoking, here are some steps that I want you to take. And so it really is and should be, because I'm not going to speak for anybody but myself. But when I ask questions and I educate, I'm not judging you, friend. Like it is what it is. But I want to again make sure that you understand, hey, this is impacting the kid's health. It's also impacting your health too. That's another conversation because that's going to impact your baby, something happened to you. But in the meantime, how can I support the decisions that you're making in a way that's safe and healthy? But yeah, we like
I'm
please
glad you actually
advocate.
brought that up because the secondhand smoke is just not cigarettes,
It's
you
not.
know.
It's all of
And
it.
I know they legalized it, but
Look,
I've gotten contact, and I'm like,
I
I
have
don't
been
want
in my
contact.
office.
I don't want contact.
I've been in my office and I can smell it when they're being treated. Golly.
But
It's
I'm
not
really glad that we're talking about this
yeah.
because I have seen a rise in that. I would say over, ooh, I would say the last 5 years or so being
Mhm.
in the field of education with children, young children.
Yep.
And you all have to understand, again, if we're in a partnership, we
Yes.
have to be
I have to
honest with
advocate
each
too.
other, right? And
Yes.
right, you have to advocate and I
Mhm.
have to advocate.
Yep.
And we have to understand the ramifications of all of our actions, whether good or bad.
Yes.
And
Yeah.
so that secondhand smoke from the leaf
Marijuana.
marijuana is very real and is very, I've seen this where
It's
the
not good for their
children are
brain.
coughing,
Mhm.
this, and I say this because the first 5 years are so formative, and
Yes.
it's too much brain, it's so many things
Yes.
going on with the child's brain,
Mhm.
their physical body, everything is developing at one time. This is something I always try to get parents to understand.
Mhm.
There's so much going on. There's so many
Yes.
dynamics to their development. And we have to be responsible.
Yes.
We have to be responsible as parents. And no, we're not judging, but we are saying that you're going to have to make better decisions.
I want
It's
you to
no different
understand.
than if you're pregnant and you're
Yep.
smoking
Yes.
or drinking. You're going to have to understand that
Yep.
what you're doing is going to affect the child. It is no
Yes.
different once they're outside of the womb.
Yes, and I'll even take it a step further, and we're gonna get a little nerdy, so follow me. But there is a concept called epigenetics, meaning that the environment that you're in can cause changes to happen in your DNA. So if the most common way to explain this is with smokers. If somebody smokes cigarettes, they are more likely to develop cancer. And then if they quit, they're over time, the time expands from the time that they last smoked, through the rest of their life, that risk decreases. That is because of epigenetics. The chemicals that are in cigarettes will cause parts of your DNA that weren't expressed before to be expressed, genes, all of that. And so epigenetics are a real thing. So if that will happen to the person smoking, these kids are also being impacted by epigenetic changes. And so we have to really understand some of the science behind it. So it's not just their brain. It's like, oh no, like now them being exposed to this chemical over and over and over has now switched something in their DNA, and now this thing is being expressed. And so I think that it's important to understand that like epigenetics is a real thing. So the way that you raise your kid, the way that you the things that they're exposed to matters. And it's not just smoking, it's red dye 40 in some of these drinks and in these treats. It is some of the foods that you allow them to eat, some of the like little toxins that we don't even think about that are in soaps and detergents and anything that says like perfume as part of the ingredient. There are chemicals in it that can change the way that things are expressed in our genes. And so I think it's really important to, again, have that conversation. And it's also my job to advocate for these kids. So if I say, hey, like they can't help that, right? Some of my kids who have ADHD and the parents are like, done. Like they're done because so it's hard. But I'm like, his brain cannot. And while there are some things that we can do to help both of y'all, it's he can't help the fact that he's forgetful. Right. But we can put some systems in place to help. We can put some systems in place to support y'all having a more therapeutic environment at home, because it is stressful, because they're in my office 20 minutes bouncing off the wall. They're in your house 24/7. And I know your nerves are bad, friend. I know. Right. And so it's really my job to be able to advocate for them and to advocate for the parents.
Yeah.
Because I've had to pull up on some of my kids. Hey, let me tell you what we're not about to do. Be disrespectful. I love you. No. We're not going to disrespect our parents. Hey, I know you can make better choices than that. Right. But we build that relationship over time. And I think especially in pediatrics, because we watch these kids grow up as like from babies. I just saw one of my babies. He's 18 months now. Walk. I mean, just who told you to grow? I did, but keep going. But stop too.
Yeah, and it's important with their development, even with that, when you say the partnership, it always, that's what this is. And it's really about the whole child, regarding every part of it. We all play a part in the dynamic of helping to raise these children. And so advocating for your child's health is very important, and I talked about this in another segment, but we may notice something, or the doctor may notice something, but as teachers or professional educators, we may notice something, and then the doctor may notice something else, or we may notice the same thing. Maybe you're not noticing this at all at home, but in your advocating, be mindful that for the most part, any teacher who is a true educator, right, they are there because they care. They care about the child. So when we're bringing something to your attention, it's not so much to, like you said, I'm not judging or anything, but we're bringing this to your attention because we see an issue.
Yeah.
And we
And
have to advocate. And so if we're saying something and the doctor says something, because it could be coming, maybe it's not coming from the parent initially. Maybe it's something where the educator is saying, hey, I see something here. I see a little red, I'm waving a red flag here because I have a concern. And then the professional, the doctor, is saying that as well. Hey, I see a concern. Parents, I mean, sometimes we have to, while it may be, it can be a shock to your system. It really can. Like, what's wrong with my child? But no child is incapable of learning. And so they may have to learn a different way. That's why as educators, we're supposed to differentiate learning, or maybe they need to be in a different setting, right? But that advocating for the health of your child, like you mentioned, Charlotte, even about the ADHD, right? Maybe the child doesn't need to sit down to learn something, and it's
Yeah.
A-okay.
Yep.
It's okay for them not to sit down
Yep.
and they can still learn. Maybe
Yep.
they're the kinesthetic learner or the hands-on learner.
Yep.
You know, they may be a visual learner, but it's okay to differentiate for that child because each child is different.
Yes. Yeah. And I think having the conversation is important, right? Like asking the question. Literally, I had this parent this week ask me about her daughter in potty training. She's almost 5. And we were talking about um baby girl's refusal. I said she has no reason to do what you're asking her to do. There's no incentive. Like, girl, you gonna clean it up. She gonna go with her life, right? Like, so we have to understand that like these kids are smart. And as I kept talking, that girl, she gave me the little thing, like she was pointing her eyes to my eyes, because no, girl, I'm blowing up the spot. You are very capable, very capable. And so one of the things that I told mom I would do, I said, you need to schedule her potty breaks. And this isn't asking, do you need to go potty? Because at this developmental age, they're always afraid they're going to miss out on something. So they're going to tell you no, they're going to hold it to the last minute, they're going to have an accident. So it's, ooh, I know that it's 10 o'clock and we went potty last at 8:30. Come on, baby, let's go to the potty. This is not for debate. This isn't a debate. This isn't do I have to. We're going to sit on the potty and we'll do that to where it becomes a habit. But outside of that, she has no incentive. I said, and then what you do is get a little calendar, let her put stickers on it. And then you get so many stickers. Now you get something out of the treasure chest. Now I'm incentivizing you. Like, hey, go out and get her favorite character. She loves Bluey. I love that for her. Get some Bluey underwear. Hey, we want to keep Bluey clean. Right? So there are all, and she was like, I never thought of that. I said, but also she playing y'all. Okay, she over here on the, if they can function with this tablet, there's some things we can do. But it requires as parents some sticking to your guns. And when I brought that up, the dad looked at the mom. She said, you do it too. You could just tell that this girl had them wrapped because they love their baby.
Oh, I've
But
seen
even
it. I've seen it so much. It's like,
yes,
what? I don't even see these behaviors in the
it's good. She was just fine. And you want to know why? Because they believe what we say. If you say, I'm going to call your dad, and you just keep repeating it as an empty threat, you are training that child up to learn. Oh, they don't mean that. Do not say anything to these kids that you are not ready to follow through on. So if I say, hey, if you do it again, I'm taking your tablet, and they do it again, take the
and
tablet.
take the tablet, please.
Don't, there's no conversation. There's none of that. Hey, I already told you what was going to happen. Take it for a set amount of time. I mean, be reasonable. But a lot of times what I find is that when the kids start to dysregulate, when they start crying and tantruming as adults, we have not yet learned how to fully regulate. And because their dysregulation dysregulates us, we cave.
Oh,
But
big time. I've
it's
seen that
sending
so many times.
it's sending a message. But at that moment, I was advocating for those parents. And I told my little friend, I said, friend, you gonna stop peeing in their bed. That's not nice. Cause she'll tell the mom was like, she'll go and then tell me, oh, I wet myself. Hey. Now listen, now friend, you doing a lot. You doing a lot. Why? Stop it now. Now stop it. Right. And by the end, the girl was like, get me out of this. Out of this office.
He was
This
mad
lady,
that she came in and she
she
said, the
telling all
jig
my
is up. The jig
business.
is
This
up.
lady telling all my business, please. But I think that having those conversations are really important because sometimes I'm advocating for y'all with these kids. Like, no, what we're not about to do is that. We're not doing that, friend. Stop. Why are you playing with your mama? Cut it out.
Can you talk about, not go into depth about who the patient was, but I remember having a conversation with you in regards to the parent was having an issue with the child's breathing.
Mm-hmm.
And you said, no, there's more to that. They were going to the doctor and they kept giving them just something to kind of, but there was more. The child had asthma.
Yes, yes, yes. Oh my goodness. Um, this was actually a friend of mine, and she was seeing another provider, and my god baby kept getting pneumonia. It was stressing me out. And she constantly had a cough because, we're friends. So she'll call me like, "Ooh, girl, like this cough," or "Ooh, girl." And she was having belly aches all the time. And I would tell her, "Hey, next time you go, ask to see pulmonology." Right? So I'm advocating as a friend and as a godparent, right? Ask to see pulmonology. Well, she would go, "Oh no, it's viral, it's viral, it's viral." And a lot of times there are things that are viral. Everything doesn't require an antibiotic. Like, okay, all right. But there was more to it. By the second time she got pneumonia, I said, "Listen, friend whom I love, bring me my baby to come see me. There is more going on here." So she literally switched practices. That's advocacy. "Hey, you're not getting the care that you need, and I don't get paid by the patient." I don't know, read that somewhere. I was like, "Why do y'all think that? Do you know how rich I would be? I am not. I don't get paid by prescription. I get paid by the hour, just like everybody else." Like, please, please, guys. Yeah, no. Mm-mm. But I told her to come and see me because I'm like, I'm tired of my baby having pneumonia. Like that's dangerous. And there's more to it. And she came, she saw me. I put her on some asthma controller medications. Immediately the cough improved. But I didn't want to just rely on my own inclination. So I also gave her a referral to go see pulmonology. So a lot of times, if you want that second opinion, go see the specialist,
Thank
right?
you.
So
That's what I
even
wanted to
yes,
grab.
go see the specialist. I am the queen of let me send you over there. One of two things is going to happen. Either they're going to repeat what I already told you. That's fine. Or there may be something more to it. Either way, by the end of that visit, you feel reassured, you feel heard, and if we can continue with the same plan that we had, great. If there's a change, we now have added another partner to the team that like, "Hey,
Mm.
oh, that's different from last month. So let's actually, when you see pulmonology again, let's go see them again." And now you already have that care team established. So I think that it's really important, like for me or to me in my practice, of like, by the third time you bring this up, I'm going to say, "Hey, let's go ahead and go to the specialist." Now, as the parents, I need y'all to go. Now I done wrote this referral. I need you to go. Okay. I know your job. I get it. I get it. But I need you to go. 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 But with that patient, um, she ended up having asthma. I said, I knew it because when you're asthmatic, your lungs are already kind of inflamed. And so every time she got sick, there was this hyper responsiveness. And that's when she kept getting pneumonia. Kids with asthma are more likely to get that. Um, and then I did some allergy testing because I'm like, this cough that she always has, it's giving postnasal drip. This belly ache that she always has randomly, I don't think that it's just anything. The same inflammation that you see when people get hives when they touch stuff they're allergic to happens in your belly. That paper came back. My baby was allergic to just everything, just everything. So we were able to make some dietary changes. Her belly, she's not having belly aches anymore. Um, and her asthma is well controlled. And I was just the friend, but irritated. Like I said, you tell that other lady, like she fired because I'm over it. My baby gonna keep getting sent to the ER with pneumonia because we won't investigate this further. And I'm advocating over here as, yeah, I'm a clinician, but I'm just the auntie by the blood of Jesus. Okay, like I'm just the auntie, and I want to make sure that they're healthy because I love these kids and I love these families that I take care of. But there have been plenty of cases like that where I've had patients where I'm like, nope, that doesn't look right, that don't sound right. We doing this. I'm intervening. I'm pretty sure that I probably get on a lot of people's nerves, but I'm here for. But that's whatever. That's my job, is to advocate for these kids, even with colleagues. Like, no, I don't. They came and saw one provider in the office. The parents weren't satisfied, came back again because this issue is persisting. And I'm going to do this, 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 and this. Nothing against my colleague, but there are just more steps that we can take. And so to me, no matter who it is, my primary concern is to always advocate for these kids.
No, that is something, because I've, and on the other end, I've had times where, the child is, their breathing, becomes irregular in the classroom, or in the classroom, and it's like, okay, what's going on? Something's going on,
Mm-hmm.
and they'll tell me, well, they have an inhaler at home, or they have, the albuterol at home, but and I'm just, why didn't you give it to them?
Yeah.
Because
Or why
we
is there not one at the school? So like
right.
when I write for inhalers, hey mom, we need to make sure that I'm sending you two, but this is me talking. I'm sending you two. We need to have one at home and at school. Asthma is really touchy because a lot of times they're like, well, they don't ever use it until they need it. The last place you want to be is in the middle of an asthma attack and no albuterol. Okay. So because I always tell parents, I said, what it is a lot of times we always think of, my dad loves Sanford and Son. So I always think of Red Fox as Fred Sanford, like Elizabeth, it's the big one. He's having a heart attack. We have been conditioned by media to think when we think asthma attack, we think, and sometimes it is that, but that starts with like constant cough, constant cough, constant cough. Give them their albuterol. Please. And then
No,
by the
that
time
was
you
a
come and see
great,
me,
no, I'm sorry. That was great, because
yeah.
I've seen that. And parents, you have to think, give, make sure the child care facility or the school has it, because
Mhm.
when they need it, they need it. If
Yep.
the weather conditions change, it can change like that. And I
Yeah.
wanted to make that sound, because that's how fast, even when you were
Mhm.
making that correlation, Charlotte, that's how fast it can change.
Yes. When kids break, they break fast and they break hard. I say that all the time. So prior to me working as a nurse practitioner, I was a NICU nurse. So I worked with premature babies. And sometimes I would have to float to the PICU. So the pediatric ICU, the neonatal ICU, and the cardiac ICU, the CICU. Please don't ever, I don't like being in the CICU. But um, when kids break, they break fast and they break hard. They're very resilient. So you'll have a kid in my office running around and their temperature is 102.6. Please take this ibuprofen and have a seat. But when they have an event, it can happen rather quickly. And so if your child is asthmatic, you don't feel like you have to, do all the rigmarole of home and school, but your clinician will be happy to give you, hey, can I have an inhaler for school? And then we send it to the pharmacy and it's just a part of it. And I think, you brought up a good point of even you pointed bringing things out to teach or to parents as an educator. And I want to advise all of the parents that are listening, when you come to see us, here are some things that I want to see. Have recorded somewhere what the concerns are, how long it's been going on, because the same way that education is my job, I need you to educate me on what's going on, right? Sometimes, not all parents, but it has happened to me. I'll never forget this day, this little 4-year-old girl that I saw. This is at the previous practice that I worked at. The mom came in, she was like, the baby's stomach was hurting. Great. Number one cause typically for abdominal pain in kids is constipation. So I'm asking, and I asked this mom, I said, well, when was the last time she pooped? Girl, she grown. I don't know. Ma'am, she is 4. Like, I need you to know. I need you brought her into what am I supposed to do with that? what 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 am I supposed to do with girl she grown? I don't know. Well, what you want me to do? Huh? And of course that was not my response in office. But I just am like when we aren't able to get complete histories, it really makes it hard for us. And so being able to write down your concerns, the symptoms, questions, if it's something like a rash, take a picture, show it to me. I've had parents show me pictures of poop. I've had parents, like, we do not care. Take a picture, bring it, show it to me. If your baby is making weird moves, record it, bring it. Hey, I have it on video. Would you like to see what I'm talking about? Show it to me, right? Like, if it's happening at home, record it real quick. Bring me all the information that you have, because it's going to be very, very helpful in us working together to identify what's going on. So a big part of advocacy is education, right? I need you to understand my why. Like, why are we taking Zyrtec every day? Why do I need to have albuterol? And I need to understand why you're concerned. I hear your concern, but I want to understand what parts of this is concerning. How many days have they had fever? Please take your kids' temperatures. Do not tell me that they've had fever for 5 days and all you did was touch their forehead. I hear you that they're warm. I hear you. But 5 days of fever to me and 5 days of fever to you, 5 days of fever to me is you're going to the hospital. We're going to do blood cultures. We're going to do CSF fluid because I'm thinking sepsis. And you're just like, oh, it's just been 5 days and I touched them. I need numbers.
I'm glad that you brought that up. And even as you were talking about with the asthma, no, this is very important to note, because some parents do this. They will just ride things out.
Mm-hmm.
And so we don't want you to do that either. I remember I had an instance, I've had, training and, first aid, CPR, what to look for. And we had a child in the program at the time, and the child was under 2. And so my employee called, my staffer called, and she's like, hey, something's going on. And so I said, well, let's get in touch with the parents and ask questions. Oh, no, they were fine, and okay. And so then I come back to the facility and I start to see the same behavior. Well, I didn't see it initially. But, she was like, no, something's wrong. And so I said, okay. And so I started talking to the child, and nothing. Well, maybe about, I don't know how much longer, the child started not being able to respond, not moving. They were standing, but they couldn't move. They were not moving. And so I'm like, okay, what's going on? And I call the parent, something is going on. You really need to come get the child. How was their night? And I'm asking these questions. And, for some emergencies, we can actually leave the facility. We have something in writing where we can leave the facility and we'll go straight to the hospital, right? We have the parents' consent to go. And so I talked to the parent, and they're like, oh, nothing's wrong. Okay. And I'm like, well, no, something is wrong, and I need you to come get them now. Right. And so they don't take the child to the doctor. They took the child home. And what was going on with this child is that they were having a seizure. Now, all of my training was that when they taught us when you have a seizure, you're laying down.
Yeah, or rhythmic motions. She was having an absent seizure, so she was still standing and wasn't nobody home.
He was still.
He was
so
standing.
I picked him up and I put him on my lap, and there was nothing. Like he couldn't move, didn't talk, nothing. And I'm like, I said, something is going on here neurologically. Like, I don't know what it is, but I do know that something is going on. They took this child home, and the child had another seizure. And for me, that was the first time I said to myself that I would rather, if that ever happened again, that I would take the child immediately. I won't even let the parent take the child home, because I had never seen a seizure that way. That is not how I was trained.
Yep.
And, and it actually happened again. I had told another employee about what happened. I think we were just having a conversation, and I was like, hey, that's the first time I had seen that. And if this ever happened again, and do you know, it happened again with another child under 2, the same way. And because I had told her this, because again, in the trainings, it's not taught that way. And so, because I had this conversation and mentioned this to her, when it happened, she said, Miss Tanya, I believe this child is having a seizure. She called me, she was calm, but she said, Miss Tanya, I really believe this child is having a seizure. And I came, it was the same thing.
Mm-hmm.
And I took the child, called the parents. We were on our way to the hospital. So when we're saying about this advocacy piece, and if the practitioner is calling you, or if the teacher is calling you, if the childcare facility is calling you, if the nurse at school is calling you,
Mm-hmm.
it's because we see something and we care
Yep.
enough to tell you, because we are partnering with you, because we're the other set of eyes.
Mm-hmm.
You're not there. We're the other set of eyes with your child now.
Yep.
And so I just wanted to bring that awareness to that piece of it. I know
Mm-hmm.
we've talked about the parent, asking about the second opinions, excuse me, and everything. But when we see that, we are moving, we're saying this for a reason.
Mm-hmm.
Some action needs to take place now and not later. And
Yep.
so with that piece of the advocacy and your child's health, please be mindful, and not, no, we're not saying we want things to happen, but we are those other set of eyes that if something is going on, it is our job to advocate for your child as well.
Yep. Yeah. Because we are a team. And so I would say, if there's ever at any point that you feel that we're in opposition, right? Then there needs to be a meeting of the minds. Most people are reasonable, right? There needs to be a meeting of the minds. Um, everybody has bad days. Like the parents too, the kid, like everybody has bad days. And so especially when we talk about like getting a second opinion, most providers are like, oh yeah, like no worries. Again, because to me it's like they're either going to re-educate and repeat what I said, and that's fine. I want you to have that. I want you to have that assurance from like me and the specialist both said it's asthma, and everything doesn't stop with me. Or they may have because again, I'm a generalist. So this actually is asthma, but also I'm concerned about this other, I call it a zebra diagnosis, because there's horses and zebras. Horses are like, asthma, things that we see on the regular, but there may be something more to it beyond what I can see. And because they are the specialist, they may say, actually, yes, and I want to rule out, these other three things. And so I'm more than happy to send to the specialist. I'm more than happy to make sure that when you take your child home, you feel confident in the plan of care. And so if there's ever a time where you feel like the treatment is incomplete, or you feel uncertain, if there's a major procedure or a surgery or a long-term treatment that's being recommended, I think that's always a good time to say, hey, can we see the specialist before we say yes or no? Typically, as pediatricians, it's going to be the specialist who's going to recommend XYZ procedure. If you feel like your concerns aren't being fully addressed, there are times where I will send a kid to for me, because I work after hours clinic, most of what I do is like sick kids. And so for me, my own second opinion is going, hey, I'm gonna send y'all to the ER. Right. And so this happened to me a couple weeks ago. I had a kiddo come in. He was in having some distress, breathing all hard. We did 2 treatments in office and steroids, and he got better. His numbers looked good. Right. So I told dad when I saw him, I said, hey, I may send y'all to the hospital. I used to be an ICU nurse. So my brain is still, when they break hard, they break fast. I'm going to see how we do with these treatments, but I would rather be safe than sorry. This was right before Christmas. I would rather be safe than sorry. We'll see how he does. And although his numbers looked good, he still did not look good to me. And so I said, look, just go ahead and go. And I will call y'all to make sure, like to see how he's doing. Sure enough, I called the next day. They kept him at the hospital, right? Because he had pneumonia and also something else, which I knew. I told dad, I think he has pneumonia. So we're gonna I'm gonna do the things. I'll write the meds. I'm gonna send the meds to your pharmacy. All the things that I would do, I'm gonna do them. But I really want you to go to the ER tonight. I don't have X-ray capability in the office, and I just don't like how he looks. I don't know. I don't want him to get tired, because when kids are working hard to breathe and they get tired, they'll stop, and that's just not. It's not okay. And so they kept him for a couple days. And so it's even I will get a second opinion of myself of I know I'm doing the right things. I know he got pneumonia, but there's a level of care here that an added level of care that needs to be there. And so uh, understand when we do things like that, we don't want to be inconvenient. I don't want to I know you tired. Don't nobody want to go to the ER. But again, our number one goal is to make sure that your child is safe, and to make sure that you feel confident too. I would also tell parents to trust your instincts. Come and see us. Come and see us. When parents ask me questions, they often leave with I have a question. It might be kind of silly. No such thing. You just have a question, and I'm happy to answer it. No such thing as a silly question. No such thing as a dumb question. Just ask the question, because it may be something that you think is small, but to us is wait, what? They're doing what? They're staring off into space and not responding, because they can have absent seizures. And now it's something that I know to look into. I'm no, actually, that's actually pretty important. Thank you for sharing that with me. Let's do X, Y, and Z. So please, speak up. Please trust your instincts, even if you don't know what's going on. It is enough for you to say something is off, something is wrong, something is different. They're not behaving like themselves. Give us as much of the information as you can, and any good provider is going to hear you and either investigate and go, hey, look, let's watch it. Sometimes we do, people don't like the watch and wait, but it's a part of it. So if your kid's having headaches, Google will tell you it's a tumor. Okay, Arnold Schwarzenegger, immediately. Don't Google. But I'm going to ask you a series of questions. And I'll tell you, hey, let's do a headache journal, because I need to know what's being triggered. When is it? The food? Is it this? Is it that? We'll give you some things to do, but there's so many different reasons that you can have a headache. They may need glasses. So I'm going to do a vision in office, a vision test. I may tell you to go to the optometrist. I'm ruling something out. Hey, I'm looking at their nose. It could be their allergies. You can get sinus headaches from allergies that are going untreated. Try this Zyrtec. Let's try the Flonase. Let's do the things. Do all the allergen removal things at home. Let's do that. Do a headache journal still. Let's see if it resolves. So we're doing these things because I don't want to send you to the specialist and they go, girl, hydrate, right? Things as simple as how much water are they drinking? Because your brain needs water, right? And so some of these things that we do that are not medication related, non-pharmacological, sometimes as a provider, I get pushback and I'm like, but then if we give y'all medicine every 3 seconds, y'all mad at me. When I don't want to give you medicine for things that don't need medicine, you're mad at me. What would you like? What would you like for me to do? But those things are really important, and we're trusting y'all to do those things, because then by the time we do all that and we go to the specialist, look, we done did boom, 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 boom. By the time I'm sending you, we've done all the things. Something is the matter. And so I think that it's important to just be confident and trusting your instincts as a parent that something is wrong. And I cannot emphasize enough that if you do not feel like your clinician is a partner, then you got the wrong clinician and you need to find somebody else. It may be inconvenient, but there's nothing more inconvenient than something happening to that child that did not need to happen. And so make sure that you understand, insurance, also arch nemesis of mine, that could be hard to deal with and navigate. So we'll give you the referral. There's a level of persistence that you're going to have in being an advocate for your child and their health. And then also too, make sure that you keep learning. There's a website called healthychildren.org. It is sponsored by the American Academy of Pediatrics. It's completely free. So healthychildren.org. And they answer all the questions So the ages and stages is there. So development information is there. Healthy living, safety and prevention information is there. Things on different health issues and vaccines, all of that information is there, and it is peer reviewed. It is from the American Academy of Pediatrics. It is literally what we practice from, in the gold standard. So you're not going to like Facebook or Instagram or TikTok. Yes, sometimes you can get answers in those places, but it's not a reliable source. Don't do that, because I tell people all the time, we're not baking cake. These are humans. So I'm not baking cake. These are humans. So while, sure, most times allergies is sneezing, coughing, runny nose, this kid just gets headaches. We're not baking cake. Right? So we have to make sure, as I remember that with myself as a clinician, I'm not baking cake. Sure, while strep typically requires a sore throat, sometimes strep is just a bellyache and a rash. I can't tell you how many times I've had kids come into my office and they're like, my belly hurts, and there's nothing else wrong, and they're not constipated. My next thing is I'm going to do a strep test. And the parents are like, their throat doesn't even hurt. I'm like, listen, it may not be, but I've seen it enough. And usually after I educate them, I'm like, sometimes it's just a rash, because strep is a bacteria, but we know it for strep throat. But group A streptococcus is a bacteria that can go anywhere. And so sure enough, yep, strep, here's some amoxicillin, see ya. Right? And so it's things like that, but we're not baking cake, and things show up differently in different kids. But being educated and knowing where to go, healthychildren.org has all of the information, tips and tools, news, research, like everything that you need to be a good advocate for your children's health is there. And it, like I said, it's sponsored by the American Academy of Pediatrics.
Thank you so much, Charlotte. I know I'm grateful for the conversation so that parents can know where to go. Listen, I'll put the link in. It'll be in, so you can go, because we want you to have the resources and tools to make sure that your child is, happy, healthy, whole. We want that for your child. And so that's why we do these episodes. But I thank you so much for your time today and all of the wisdom and information. And parents, please continue to advocate for your child's health.
Please, you are an essential piece to your child's healthcare team, right? Like, you are with them most. You're oftentimes the communicator between myself and the teachers at school. And so you are that essential piece. You're the quarterback, right? Like, I'm just here to help, but as the parent, you are the quarterback of the team. And part of being the quarterback is like, you get to decide, like, hey, this person is not good for the team. They are not a starter, right? You got the ear. And so you can make, like, look, if you got to make cuts, you got to make cuts sometimes. And so don't be afraid to find another doctor. Don't be afraid to advocate, because sometimes they just ain't it, friend. And that's okay. That's okay. Make sure that you ask questions, equip yourself with the knowledge that you need. Go to healthychildren.org. Ask all of the questions. When you come in with a concern, pictures, videos, all the information that you can give us, ask for that second opinion when you feel like it's necessary. And all of this will make sure that your child receives the best care possible. Everybody's goal is for us to have healthy humans that can take care of us when we get old. Okay, that's the goal.
Well, thank you again. And we know that this information is going to help you as you continue to advocate for your child.